Good evening, sir. Can you hear me?
Perfectly well.
Okay, sir. We'll just wait for Aarti to join.
Yeah. You can hear me properly. You can see me properly, right?
Yes, sir. Absolutely.
All right. This is not better? No. Is this better?
Sir, this is better.
Good evening, Dr. Kersi.
Hi, seeing you after ages.
Yes. I think almost 5 years.
Must be, yeah.
So how you have been very active on social media, I can see, I must say.
We try to do a little bit, yes.
Right.
How
So
are you?
I will just welcome all the Lion members, and I'll introduce first you, and then I'll ask even our district governor to say a few words, and then everything is yours. Then you can take over.
Yeah. We have about an hour, right?
Yeah. Yes.
So about 45 minutes talk and the rest.
Yes, and then you can we can open the forum for any question answers.
Take.
Shri, sound and all is fine, right?
Yes, everything is fine.
Okay, we are going live on YouTube channel. So I would request everyone to kindly, you can even switch off your cameras. Only doctor's camera will be on. And yeah, Tasneem ji, whenever I will, I mean, take your name, you can just, you can say a few words that time.
Arti, Manoj Bhai has joined?
No, not yet. I can't see him.
No, no.
He's joined. He's joined.
Ah.
Yes.
I think Urvi and all are joining. Pinky.
Yeah. Yes.
I just put a reminder again.
Yeah, I also broadcasted the message again.
Mm. Doctor is not yet joined, no?
Yeah, doctor is here. Dr. Karsi Chawda, he's here.
He's already joined.
Yes, yes.
Doctor.
He was the first one to join.
Wow.
I've also joined. Hello.
Hi,
Hello.
Urvi
Hi.
is there. Urvi is come.
Yes. So,
Okay.
doctor, we have all our, like main core team of Lionism over here of our
Hello.
district.
Hi.
Hi, doctor. How are you? Welcome to our group. It's
Thank
lovely
you.
having you on board.
Thank you so much. It's very kind
We
of
are,
you. Thank
we are waiting to hear you.
you. Okay.
So, kitne हुए Arti? How many people have joined here? 19.
19, yeah. So we are also going live on Vijayanagar.
YouTube. Yes, right.
Will always remain, like with everyone. Tomorrow we'll share the link also of the recorded thing.
Yeah, right.
Yes, Tasneem, good evening.
Hi, Dr. Saab. Good evening. Good
Hi,
evening.
Kersi, how are you?
How are you?
Good evening. Kersi. Long time
Kersi.
I'm seeing him after 40 years.
Yeah, I
Looking
know.
handsome as ever.
क्या सर और कोई मिलता नहीं है आपको?
I'm Kersi. Dr. Shobha is also there on the group, huh?
Is it? I don't
Yeah.
see her. अच्छा.
She is hiding her face. That's a different thing. And she's joining from US.
How lovely. I know. She told me she
Yeah.
asked for the link. So she did tell me. Yeah.
Yeah, I came to know because of her. I had missed the link in the group.
Ah.
So we have got all elite company in the group today. क्या बात है?
Hi everyone.
Hi, doctor.
Hi.
This is Dr. Shobha.
Yeah.
Yeah. Yes.
Video
I'm Dr.
बंद है ना?
Shobha here.
Ah,
हाँ. Yeah, hi.
Hi everyone. Good evening.
Hi.
Roma, good evening, Roma.
Good evening.
Hello everyone. Hello Dr. Casey.
hi, Dr. Shobha.
Yeah.
Time is it over there?
It's around 10 o'clock in the morning.
Oh, that's not bad.
Yeah, definitely not.
So
So
Yeah.
we have almost 31 people joining and people are still joining. So maybe in 2 minutes time we
Yeah,
can go
because
live. Yeah, we can
I
start.
think it's exactly 8 o'clock. No, 1-2 minute ऊपर.
Yes.
It's 8 o'clock and 1 minute.
So should we start? Should we go live?
हमारे गवर्नर उधर ही है. गवर्नर सर.
Yes, ma'am. Presiding
हमारे
officer, आप दोनों जैसे करना है करो.
आइए आप जरा हमारे डॉक्टर साहब को वेलकम कीजिए. आपका फेस दिखाइए.
और मेरा लैपटॉप चालू हो जाए 5 मिनट में.
हाँ,
बताओ.
yes.
ऑलरेडी मेरा फेस तो विजिबल ही है. हाय शोभा जी, हाउ आर यू?
Hi, yes, I'm fine.
How are you?
Fine, absolutely fine. So you are presently in US?
Yeah, it's morning here. It's 10:30.
Okay, fine.
Yeah. Shobha City.
Just a moment.
गवर्नर सर और डॉक्टर केसी ऑल्सो इज ऑनलाइन. वो आ गए हैं. फर्स्ट वन थे
हाँ.
सबसे पहले.
कल मुदस्सर सर बहुत तारीफ कर रहे थे.
That's very kind of him, yeah.
No, just to put in a word, he's too good for this. I'm telling you.
Arre,
Oh,
So
wow.
good for this मतलब क्या?
I have no
The
idea what
topic
that
which
means.
you have no, I mean to say the topic which you have chosen is the right person to tell you.
अच्छा.
Good evening, Governor.
Good evening,
Very
Dr.
good
Mudassar.
evening. My governor, good evening.
A very good evening to the presiding officer, governor, and everyone.
विनीत जी वेलकम.
Good evening. Good evening.
आरती अच्छे सब ज्वाइन हो रहे हैं. See, it's been, I think everybody is waiting for this session.
Good evening, everyone. This is Chandra Prakash Mittal from Vasai Ayush.
Welcome, sir. Welcome.
Thank you, ma'am. Thank you, ma'am. Thank you.
Good evening everyone.
Good evening. Good evening. Should we start now, Aarti?
Yeah, I think should we start? Yeah.
Governor?
Yes, Governor
Start
sir.
करें?
Yeah, you are the presiding officer. You should start.
Yeah, so I'll just ask my team to like go live on our club, so people can watch from YouTube also.
Yeah.
Shri, can you start live?
Yeah, Aarti, it's already live.
Oh, it's already live. Okay. Okay, so Tasneem ji, you want to start or should I just
No, you start.
Yeah.
You start.
Okay. So good evening, all my Lion family and over here present. गणेश फेस्टिवल की आप सभी को शुभकामनाएं. आई एम लायन आरती सूर, chairperson of Global Focus Area Mental Health District 3231A3 and also president of Lions Club of Vijayanagar and the CEO of Parisar Asha. So at Parisar Asha we have the Center for Emotional Wellbeing and free mental health helpline also. So today on behalf of Lions International, my home club and Parisar Asha, I welcome all Lions, their family and friends in today's special webinar, Aging with Grace with renowned psychiatrist Dr. K.C. Chawda. So we are going live also on Vijayanagar's YouTube channel. This is our first online mental health initiative under Lions Club to promote mental health. As you all are aware that this year Lions International introduced mental health as 9th global focus area, because this new pandemic, and I'm so happy that our district governor is very passionate about promoting mental health so we can create a happy and healthy society at large. Here I acknowledge the presence of our district governor MJF Lion Manoj Babu, global service team coordinator Lion Tasneem Haryanwala, and I can see many past presidents, past district governors over here. So all of you, a warm welcome from us to all of you. And we just thought it was a global senior citizens day on 21st August, and we thought this is the right topic to start the webinar series, because we all are slowly heading towards old age. Many of us may have already reached this milestone or caring for super senior citizens. Let's celebrate life, because not everyone is so fortunate to get old. But along with old age, there are challenges too, especially health and mental health. So before I actually introduce today's speaker and we start, I'm sure everybody is really, like waiting for Dr. Kersi Chawda's talk today. But before that, I would request Manoj ji to address the audience, and then Tasneem ji, if you can say a few words. So over to you, Manoj ji.
First, I'll ask Tasneem to share her views.
Yeah, okay, sure.
Tasneem ji.
Tasneem ji, you're on mute.
Yeah, okay. So, good evening, everyone. And Governor sir, हमारी presiding officer है Aarti. She is really so enthusiastic about this whole thing, about mental health. आपने जो एकदम सही person you have selected for this post. She is very, very enthusiastic. And today we are honored to have Dr. Kersi Chawda in our midst. वो जब क्या हुआ था 21st को we had decided to have the webinar, but unfortunately due to some date issues Aarti could manage and postpone it for a week. So today it's great having him here. And Aarti, thank you so much for giving us this honor. Thank you, Governor. Thank you, Kersi ji, Doctor. And thank you, everyone.
Well, thanks. Well, today's presiding, shall I start my speech?
Yes.
Yeah.
Governor.
Today's presiding officer, our global focus area chairperson for mental health, Lion. One second. Huh? Am I audible?
Yes. All good.
Yeah, Lion Aarti Savoor, along with global GST team, Lion Tasneem ji Haryanwala, our second vice district governor, I am saying him also, he's over there, Vikas Saraf,
Okay, he's come.
along with our past district governor, Khwaja Mudassar ji, the region chairs, the zone chairs, and of course, today's main faculty, I would like to say, this main speaker. Hello.
Yes. Go ahead.
Yes, Manoj bhai.
You went on. Okay.
Hello.
Yes. Now you're audible.
Is it audible?
Yes.
Just a moment, huh? Just a moment.
You're audible, Manoj. Go ahead.
Yeah. Today we are really fortunate to have Kersi sir, no?
Yes.
Chawda sir. Kersi Chawda. I was just trying to remember his name. Kersi Chawda sir, along with us. And to age with grace. मेरे हिसाब से चीज ये ऐसा है कि to live each moment very joyfully, isn't it? And accept changes gracefully. And the most important thing है कि भाई जो भी हम सीखते हैं वो सबके साथ शेयर करें, वो चीज होना चाहिए. Or I'm not a mental expert on these things, and today the great speaker is along with us, and he will be guiding us how to age gracefully. The two people which come to my mind are from the film industry, is Hema Malini and Amitabh Bachchan.
Yeah.
And from our district, I would like to say there are many people whom we idolize, that is Raju Manwani. They are aging very, very gracefully. And even I want to go on the same path, and I would like all the people of our the district members also to age very gracefully. We should be very, very thoughtful. The most important thing is what is going on inside our mind. Each and every mind is most important, and how to take care about it. Our mental health is of prime importance. And I'm really grateful to Aarti ji and the Lions Club of Vijayanagar for taking up this very, very important topic today. And I'm really very excited to listen to Kersi Chawda ji today, what it will be going on. I will be coming for my final comments after hearing Dr. Saab, and looking forward to his looking forward to the interaction with him. Definitely. Okay, thank you once again, Aarti ji and Tasneem ji, for organizing this show. Thank you very much.
So I think we should start with Dr. K.C. Chawda's tiny introduction, but it's very long. We have to cut it down, but I'm sure we are really blessed to have a celebrity doctor over here with all of us. So Dr. K.C. Chawda is a past president of the Bombay Psychiatry Society, consultant at the PD Hinduja National, Hinduja Healthcare, and HN Reliance Foundation Hospital. He had been and currently is chairperson of the task force of the Indian Psychiatric Society, IPS, dealing with school psychiatry and counseling. He was panel member of the task force of the IPS dealing with ethical boundaries between client and doctor. This is now being taken up by IMC as a guideline across Indian health services. He was chairperson of the task force of the IPS dealing with the LGBTQ community. He managed to issue a position statement that was quoted in the landmark judgment by 2 of the 5 learned judges when they repealed Section 377. He was panel member of the IPS task force that laid down clinical guidelines for the treatment of autism spectrum disorder. He had been chairperson of the IPS task force dealing with college psychiatry. He had been chairperson of the IPS TF dealing with media relations. And his field of interest is kids. He had been part of the first panel of the Maharashtra government that had laid down concessions for learning disabilities in Mumbai, written a chapter in 4 books. He has been a TEDx speaker. So a warm welcome to Dr. K.C. and thank you so much for accepting my invite, and we are all very eager to listen to you, because we all have senior citizens at home.
Yeah, I'm a senior citizen as well. So thank you. Okay. It's a pleasure to be here. Thank you for all the warm words that you have used. I think they're highly exaggerated, but I'm not complaining. So thank you. Before I actually get into what we can do in order to age with grace, I think it's absolutely essential for us to be aware of the fact that we are all getting old. It's absolutely essential for us to be aware of the fact that what used to be a life expectancy of about 45, 47, now in India has reached close to 70 for men and about 72 for women. Highest life expectancy is supposed to be in Kerala. During COVID, we actually lost a few years. That is the first time it ever happened when the life expectancy fell. So even though we talk about vaccines and COVID causing problems, nobody really talks about the fact that our life expectancy went down. So COVID is an important issue over there. We are looking at the fact that now, even though people live longer and longer years, and women are known to live longer than men, we cannot do too much in terms of how well a person lives. So we are seeing a huge amount of dementias. We are seeing a huge amount of depressions. We are seeing a huge amount of neurodegenerative disorders similar to Parkinson's and things like that. We are not most of us now no longer live with big joint families. So when there's only one person who's looking after somebody who's aged, and if that one person is a spouse who's also aging, it becomes a little more difficult to deal with them. I figured that rather than just jump into what we should do when we're getting old and how we can kind of enjoy our getting old, I think it's a little important for all of us to talk about the various problems that we could face in the process of aging. And I think it's even more important because in my private practice, I have a huge number of people now who come in who are about the age of 60, 65. And when they come in and they talk about the problems that they are facing, and I say that, why didn't you come a little earlier? They just say that we never knew that it was wrong. We never knew that there was something happening. We never knew that something could be done. We just thought, theek hai, hota hai, it's all right, we'll get over it. And the bottom line is, the earlier we get a person, the earlier we can diagnose a person, the more the earlier that we can start treating the person, the more effective is the treatment. And by and large, the more complete is the treatment. So it's essential for all of us to be aware of the problems that the older person faces before we actually get into what we can do to reduce or diminish the signs and symptoms that sometimes break our heart when we are dealing with the older person. I remember my daddy expired when he was about 87. My mom expired when he was 86. I'm a Parsi. We have horrible genes. We live forever and ever. And when we had, I remember once the mom calling me and crying, and she said, Casey, your dad's writing out a check, and he insists on writing the address on the check. So I went up to him and I said, Dad, you're not supposed to write the address. And he looked at me and he says, really? You're not supposed to? Okay, I won't. And it broke my heart. This was a man who had been a very, very successful manager in his past. He had led a huge number of people, and he had become a caricature of the person he was to that time. Alzheimer's, dementias, neurodegenerative disorders are rampant. The hassle also is that we have hardly any geriatric psychiatrists. These are psychiatrists who basically deal with old age. We have almost no geriatric psychologists. These are persons who have some experience in doing counseling for people who are above 60, 65. So it becomes even more important for us as lay people to be aware of what we should be looking out for, because all dementias are not only related to memory lapses. So let's start. In 2023, the Alzheimer's Association, I mean, everybody talks of Alzheimer's now, said that there are about 50 million people in the world who have Alzheimer's. And of the dementias, Alzheimer's is the largest amount. We have something called vascular dementias as well. And why is it important for us to remember all of this? It's important because there are different etiologies. That means they're caused by different things. There are different symptoms that occur when you have, say, a frontotemporal dementia. Now, if you're looking at parts of our skull, this is the frontal, this is the temporal, this is parietal, this is occipital. Depending on which part of the brain gets affected, you'll end up having different symptoms. And those symptoms may actually be part of the dementias. But if you're only looking for, oh, he remembers well, oh, she remembers well, we're not really going to be paying attention to the other symptoms that are there. So then the person doesn't get the treatment and the help that is so very important for him. There's a huge amount of work that has now gone into the dementias because the whole world is getting old. And one of the things that they have found is something called abnormal proteins. So especially in Alzheimer's, you have something called beta amyloid plaques. You have something called tau proteins. You have tangles which occur, because of which very often you find that a person repeats things. You find that the person goes in a loop and it goes on and on and on, and it gets very, very irritating for a caregiver. You have a mom and the mom says, can I eat something? And you say, just give me 10 minutes again. Can I eat something? Give me 10 minutes. Can I eat something? Okay, mom, I'm going to give it to you. Keep quiet. Why are you shouting at me? Why are you getting angry with me? We are all human as well. But unfortunately, this very often happens when you have a person who's getting into dementia. Today, we know that almost all, if not all, dementias are associated with mutation in genes. So many, many years ago, when Freud ruled the roost, we would talk about other things. We talk about psychological issues. We talk about social issues, which may play a very, very small role. But by and large, today, it's all biological. Today, there are proteins. Today, there are amyloid plaques. Today, there is mutation in genes. Today, there are vascular changes that we see, which cause the problem. And because of our new investigative procedures, it's very easy for us now to actually find out what is happening, to actually see where it is happening, and to almost prophesy the kind of signs and symptoms that we're going to see. So for example, if you have this thing called frontotemporal dementia, there is degeneration in the frontal and the temporal lobe. And because of that, First of all, you will have problems associated with behavior. You very often have problems associated with personality, and the temporal area is related to language. So you suddenly find a guy who used to be so good, but he finds that it's difficult for him to pick out the right word, and he starts stuttering and stumbling. And you start wondering what is happening, but nobody actually thinks of a dementia process. The sad thing about this is that it happens at the younger age, 45 to about 60. There's a particular buildup of another kind of nucleus protein, something called the alpha-synucleus protein. And this is another kind of condition which is called the LB dementia, Lewy body dementia. Here you have cognitive processes which get affected. By cognitive, I mean understanding, using intelligence, knowing that if I go down a one-way street and somebody comes the other way, there may be an accident. Knowing I have to look left and right before I cross the road. So very often when these things get affected, you have a guy who's been a very bright person and suddenly gets lost, doesn't know how to cross a road, etc., etc. And all of that causes problems. Lewy body also is associated with visual symptoms. So you actually start seeing things which we talk of in terms of almost visual hallucinations, which can be very problematic. And there are motor symptoms as well. So his normal movements get restricted. Today, everybody talks of Parkinson's. Parkinson has become a very common kind of thing that people talk about. We have some celebrities who have got Parkinson's, and when you look at them and you see the way they're walking and you see the way they're talking, you feel very, very sad. The problem also is that in Parkinson's, we'll end up getting memory lapses. We'll end up getting problems with cognition. We'll end up getting repetitive things. So very often a neurodegenerative disorder, which is what Parkinson's is also associated with dementias and things like that. One of the most important things, and I say important because to some extent it might be reversible, is what we call vascular causes which cause dementia or vascular dementias. Here you have small vessel diseases which get affected. So in our brain, we have large vessels, small vessels, blah, blah. And because of the small vessels which get affected, you might have an infarct in that area, which is basically a lack of oxygen going to a particular area. There may not be adequate perfusion which comes from other joining arterioles, etc. So that part of the brain gets damaged. It gets what we call hypoperfusion. And when that happens, and especially if it is what we call multi-infarct, you'll end up getting major problems associated with signs and symptoms, which make you wonder whether the person has dementia. And the most important aspects of this is related to smoking, is related to obesity. So it is imperative for all of us that when we talk of smoking in terms of cancers, to not forget that smoking can also be associated with vascular problems, which then lead us to have dementias. Here also you have small strokes. Over and over again in my hospitals, I'm called in to see a person. And when I'm taking the history, an older person, when I'm taking the history, they say he used to be a chronic smoker. Now he can't move his right hand. And one of the things that we do, of course, is we try to reverse whatever be the damage that has been caused. But we constantly tell the person, now you have to stop smoking. You have to lose weight if you're obese. Smoking and obesity are two very, very important issues. We must also remember that there are certain dementias which occur more in males. One of them was the LB body, the Lewy body male, which I was talking about. Somehow it comes more in males, so we get the worst of it. You have mixed ones, combination of Alzheimer's pathology and vascular damage, common in the older adult. We have a particular kind of a problem, which is often seen with the army personnel or with boxers or with people who are playing contact sports and who keep banging their heads. So for example, the horrible rugby games that we see in America, which is so contact and people bang their heads into each other. There is a history of concussion, and very often constant, periodic, repetitive concussions can cause problems. Infections. HIV, something called CJ disease, Creutzfeldt-Jakob disease, syphilis. Now we all are aware of sexually transmitted diseases. Unfortunately, it seems to be on the rise in our country. When I was a medical student many years ago, we were speaking only of syphilis. Today, we don't see so much of syphilis, but we see an enormous amount of HIV. Amongst the various issues associated with HIV is dementia. So this is again an extremely important reason why we must use condoms if we're getting into sex with people whose sexual history we are not aware of. People talk of multiple sclerosis. Once again, an autoimmune disease, very, very important, unfortunately, again, becoming very commonplace. This again is associated with autoimmune problems. Again, one reversible thing. If there is severe B12 deficiency, if there is severe thiamine deficiency, if there is severe hypothyroidism which has not been looked at, or severe hypoglycemia, which is a low blood sugar which has not been looked at, and you reverse it, very often the signs and symptoms which come across right in the beginning, where the person comes to you because he says he's forgetting things, or he's getting lost, or he can't remember things, etc., etc., these things start reversing. So they are lovely. I mean, when you have something that is reversible and you do whatever you can to ensure that the reversing happens, then you're on a very good wicket. Now, let me also say that we have dementia and we have something which is almost like a pre-dementic form, which we call MCI, mild cognitive infection. So when you have this MCI, you land up having problems, but they're not so severe. And my strong recommendation to all of you is that when you just start seeing the changes that are associated with it, do not take it that, oh, this is normal aging and I can't do anything about it. And who the hell is going to go to a neurologist or a psychiatrist? Anyway, they'll ask for multiple tests and it's just a waste of time. And it's a corporate hospital which wants it. Balderdash. If you have problems associated with cognitive problems, if you have problems associated also with memory, if you have problems also associated with behavior, a kind of a disinhibition. I mean, I remember there's so many times when a very embarrassed son comes up to me and says, Dad used to be so circumspect. Now in front of everybody, he just takes off his clothes. Is there something wrong with him? Is he turning psychotic? And no, he's not turning psychotic. He's just getting the beginnings of dementia. So if you start seeing things like this, do not waste time. If it is reversible, you'll be doing a fantastic job by starting treatment as early as is possible. So the things that we have to look for and that we have to control are hypertension, obesity, vitamin B12, vitamin D3. Smoking is probably the most important. If you're drinking too much, we have to control that. Now, this much for dementia, and I don't want to frighten you guys, but I will say that we are getting more and more and more of dementias occurring, just like we're getting more and more adults who are above the age of 60 coming to us. And when I'm sitting in my lab, in my hospital room, and I'm watching, because there's a kind of a central area where patients sit while their names are called and they go to the various doctors who are in the various corridors, we see and are seeing more and more people above the age of 60, 65 coming in. We see them walking in. If they're very lucky, they have family, because a lot of family now goes to another state, goes to another country, goes to another continent, provided Trump allows it. So we're going to see a lot of it happening. We're going to see a lot of people coming in alone. Sometimes they come in with a caretaker. Sometimes they come in alone. What we need to do is to be aware of the fact that if you have a suspicion that anybody in the family or anybody is your friend or even a neighbor is showing signs and symptoms of slowing down, talking a little irrelevantly, seeming to forget things, getting lost, doing things like leaving the door open, doing things like leaving the gas open. Don't shout and scream and say, oh my God, where is your mind? What is wrong with you? Get him evaluated for dementia or mild cognitive impairment. It's extremely important. So much for the dementias. Let's also not forget the other important issues. Depression, the commonest psychiatric issue. Very common in childhood, very common in adults. So if you're looking at depression, when I was a medical student, we were told that you had time periods where you got very depressed. So one was the commonest one, which is still there, is at the time of adolescence. And at one time, we would say 16, 17, 18. Today, we're diagnosing at 8, 9, 10, which is a terrible indictment of what's happening in our society. The second common one seems to be at the age of 40, where you kind of look behind and you kind of figure out whether you've been successful or not been successful. And the third very common time is the geriatric age. You have the empty nest syndrome. You've been with a spouse or a partner and one of them is no longer there, so you're absolutely alone. You've retired, so nobody treats you with the respect that you had when you were working, because that's what life is all about. You're no longer important. People tolerate you rather than ask you to come and join them. If you're very unlucky, you lose money, and then it's very difficult for you to manage the lifestyle that you're used to. And you'll end up getting depressed. And when we land up getting depressed, we feel sad, we feel hopeless, we feel guilty, sometimes we are angry, we don't sleep well or we sleep too much, we don't eat well or we eat too much. Very often there's a physical ailment as well. You have diabetes, blood pressure, blah, blah, which pops in addition to the other problems, and those have to be treated. And those complications, if they do occur, are very, very problematic. We have more people falling as they go older. Somehow there's a lack of imbalance, there's a lack of balance and things like that. All of those things are known. In addition to that, you also land up having anxiety. So in addition to the depression, which is the most important thing, you land up getting anxiety. And the older person is racked with anxiety. He wonders how he's going to cope. He wonders what he's going to do. And there's a lot of anticipatory anxiety, which is very irritating for people who live with him. Because it will be like, oh, you're going out, be careful, cross the road carefully. When you reach there, please give me a call, because I don't like it unless I know that you're okay. And you say, Mom, I'm an old person. Don't worry. No, but just do it. No. And people get irritated. Now, I must tell you that nobody gets up in the morning saying, what can I do to spoil the life of my kids? They're doing it because they don't have the choice. They're doing it because they cannot control their own emotions. A huge number of people are aware of the fact that they're doing things to irritate their family, but they can't seem to stop it. And when we have things like anxiety, one of the things that also occurs is severe anxiety causing panic attacks. And I'm seeing so much of that happening in the older adult as well. At one time, we would say only small little things would cause a problem. Only small little issues would make you feel a little scared. And then there's this constant feeling of dread. And then you land up, your heart starts going thud, 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 and you'll end up feeling breathless, and you go running to the windows because you feel that you can't breathe properly. And you get these visuals, black and red, flashing across your eyes, and you feel imbalanced. And you're convinced you have a heart attack. You start sweating, cold sweats. You're rushed to the hospital, and in the emergency, they do a whole bunch of tests. And they say, yes, you have an attack, but it's not coming from the heart. It's coming from the brain. It's a panic attack. So panic attack is such acute anxiety that you think you're going to pop it. And the good thing about panic attack is it's very easily controlled, provided you seek help, provided you seek treatment, provided you're aware of it. Hence the purpose of talking about it. Now, I'll also say that nothing is totally compartmentalized. So it's very rare that you'd see a person who's depressed not being anxious, or a person who's anxious not being depressed. These things don't happen. Persons who are depressed are also anxious. Anxious is also depressed. Sometimes I have patients coming in and say, oh, I don't have depression. I've only got anxiety. So what's the difference? It doesn't matter. You have a problem, you've got to deal with it. And the faster and the earlier that we deal with it, and the more circumspect we are about it, yes, I have a problem. I've got to take medication. I've got to see a doctor. I've got to seek counseling. I've got to do what I have to do. The more effective is the overall result. We land up also, especially after COVID, landing up with much more OCD than before. Now, what is OCD? We know it means obsessive compulsive disorder. Now, what's an obsession? I get a thought or a feeling or an idea that something is wrong. So I get a feeling that my hand is dirty. Okay, that's an obsessive feeling. Because of that, I have to do something to reduce my anxiety. So I start hand washing. So that's the compulsive action. And I keep hand washing and I keep hand washing and I keep hand washing because it reduces my anxiety. And it has to be done in a particular ritualistic way. So first I might hand wash only till here, then I might hand wash till here, then I might hand wash till here. And if I missed it, then I have to start all over again. And what starts off at 5 minutes, then becomes 15 minutes, becomes an hour, and I'm stuck in the bathroom. And I know that there is a problem, but I cannot prevent it from happening. I remember during COVID, I have a friend in America and he has twin girls, little kids, about 8 years old. And he sent me this cute little video of theirs. He said, have a look at my kids. They're singing and they were singing, happy birthday to me twice, because we had told them 30 seconds of hand washing. And apparently if you sing it twice, it's 30 seconds. Very cute. 2 months later, he sent me a SOS saying, Cassie, do something. Please do something. They've gone berserk. Apparently, they were spending about 4, 5, 6 hours just doing this because they couldn't stop. They had got into an OCD, one of the youngest OCDs that I'm aware of. You have OCDs related to hygiene. You have OCDs related to religion, where you can't stop praying. Now, we are all spiritual. Indians are supposed to be very spiritual, very religious. But if you spend 8 and 10 hours praying and you have to pray in a particular way, and if you don't pray in that particular way, then you're convinced that something bad will happen to your kids or something bad will happen to the family, then you're in trouble. We have to check. So I will go and I will check the lock 5, 7 times. I will put the switch off and I will check it about 20 times. It's terrible. It can be very, very pathetic and very difficult. And COVID has aggravated it. So we are seeing a huge number of the older generation also having OCDs, and they have to be checked. Once again, I repeat what I keep saying to people. He's not doing it to irritate you. He's doing it because he cannot prevent himself from doing it. It's a mental issue. It's a psychiatric issue. It's not something that he looks at you and says, I don't like your face and I'm going to irritate you. Addictions. People who smoke, people who drink, especially if you get older, very often you need less and less of it in order to get high. But it's not easy for you to reduce. It's not easy for you to stop doing what you've been doing for so many years at such a level. It's not easy for you to allow yourself to sleep, for example, or to allow yourself, even disgusting though it might sound, to be able to pass motion. Because a lot of people get up and say, oh, I can stop all the smoking, but in the morning I have to have a cigarette, otherwise I don't pass motion. All of this can be remediated with appropriate medication. But you have to want to give it up. We know that vascular problems, that drinking too much aggravates a whole bunch of problems. And this whole thing of a tot of wine a day or 1 peg a day has been discredited. Yes, we might enjoy drinking, but there is a certain percentage of people who cannot stop. I might be able to stop drinking after 2 or 3 pegs in a week, but a person may not be able to stop even after 8 pegs, after 10 pegs, and then he makes a mess of himself. He does things which are inappropriate. He's embarrassing to the family, and he might end up doing things which actually get him into legal or police trouble. And that can be a problem. So we have to deal with the addictions. We should also remember the fact that if you're smoking, like I've already said, there's a higher than normal tendency towards getting cancers, vascular problems, and then you'll end up getting dementias. So in addition to the physical problems that you face, you also land up having psychiatric issues. And it becomes more and more difficult for you and the family. So we've got to do things about it. And let me also talk a little bit about the main paranoid psychosis, which is very commonly seen, especially with the older person, where suddenly you'll find that mommy is putting all the spoons in the cupboard. And you ask her why, and she says, oh, you know, that servant, she comes and she takes away a spoon every day. And whatever you tell her will not make a difference to her conviction that it is happening. Seen in dementias, seen in particular kinds of dementias, and they have to be treated. Okay, so we've got all of these things, but there's still a huge number of people who don't have it. So if you don't have any of these, wonderful. Most of us will end up having hypertension or diabetes. You might have a thyroid problem. Provided you're looking after it properly, provided you're taking medication which is needed to control it, it's wonderful. But if that does not happen, then get it happening today. In spite of that, we still talk of lifestyle changes in general, which are very, very useful for the older person as well. Sleep adequately. 7 hours sleep is a good idea. And what we normally do is we say, try to sleep in the darkness of the night. So sleep by about 11, 12 and get up by about 7 or whatever. A lot of people say, oh, I sleep at 2, but I get up at, and I get up at about 8 or 9 and it's okay. And I compensate in the afternoon and I say, it's not okay. We have a gland over here called the pineal gland, releases a lot of stuff, including something called the melatonin, which is a very, very important neurotransmitter. And if you don't have the darkness of the night, then it's going to be problematic because the release of melatonin is not very good, not very effective, and that causes a problem. So it's a good idea to sleep early. So sleep adequately. Hydrate yourself enough. I cannot emphasize this enough. The older person very often goes into dehydration, which can cause problems because he forgets to drink water. And maybe his temperature regulation of the body is not as effective as it would have been 20 years ago. So we've got to drink adequate water. We've got to remind ourselves to drink adequate amount of water. As a corollary to that, you drink too much water and you're going to land up diluting the electrolytes in your body. So we've got to be careful about that as well. Try to ensure you're not constipated. It makes you very uncomfortable. It's not good physically. So use whatever you can if you're not passing motion every day. Ensure that you land up having enough water because that again is useful. Have enough fiber because that is useful. Those things are very, very beneficial. As a lifestyle, try to incorporate some physical activity in your life. Rule of thumb seems to be 45 minutes, 5 days a week of anything. Walk, run, cycle, play a game, do yoga, go dancing. It doesn't matter what you do. It doesn't even have to be the same thing every day. But it has to be a lifestyle as long as possible. Over and over and over again, all the research has moved toward the fact that constant, regular, appropriate physical activity is something that is one of the most effective and best ways of reducing a lot of old age illnesses or slowing it down. There are also research papers that talk about the fact that, especially for women, if you do regular physical activity, it seems to reduce or prolong the onset of cancer breast, which is wonderful because if you can prolong it, if it doesn't happen for as long as is possible, then we should do everything we can for that because now cancer breast is becoming so extremely commonplace. So hydrate yourself, sleep enough, exercise enough. If you're drinking, don't drink too much. If you're smoking, stop. If you're having substances, marijuana, coke, because a lot of my clients now, even the adults are doing it, please stop it. I don't really think it's going to do any good for you, and it certainly does a lot of bad. Corollary to that, we get into this bhang during Holi and stuff like that. I've seen horrible results of people who have taken bhang. So especially for the older generation, I'd suggest that we can still enjoy Holi and other festivals without necessarily taking something that can cause a problem. What are the other things that we should do? We should be aware of the problems. I mean, that's just why I spent the first 20 minutes talking about the various issues that we see. We need to be aware of it because we can only treat it or look for help for it if we know that such a thing exists. If I didn't know it existed, I wouldn't seek help for it. I think it's okay. If I didn't know it existed, I think my dad was acting like an ass. If I didn't know if there was a problem, I wouldn't take special care to ensure that my sugar is under control, that my blood pressure doesn't go out of sync, that I'm exercising enough. So we have to be aware of all these things. And once we are aware of it, we have to make it happen. Seek help. Go see a doctor, go see a therapist, go see a neurologist, go see a psychiatrist. It is essential for us to get a proper evaluation. And I'm telling you, the common evaluations would be initially, they'll probably do an MRI of the brain. They might do they might also do a study which checks out the vascularity, which says MRI and MRA. They might ask for a CT scan. They do the routine blood test, of which the most important would be the vitamins, the blood, the sugar, the electrolytes, lipid profile. These things are extreme. Blood urea, serum, creat, because if there is a problem for kidney, then we have to look at that. Check out your sugars. It is essential for us not to believe in magical thinking and not to shove our heads in the sand and believe that if I don't talk about it, if I won't go to the doctor, nothing is going to happen. It's going to happen. So we cannot allow that. We have to get checkups done. Unfortunately, all my audience are probably in a position where they can afford these things, so get them done. The other thing, like somebody says quite correctly, is start practicing what I'm saying. It has to happen today. It's not to be happening next week, next Monday, after Ganpati, after I come back from a holiday. No, it has to be a lifestyle change. It has to happen. What are the other things that are useful? I mean, we've all read about this thing of try to keep yourself as involved as possible. And I cannot emphasize it enough. As we grow older, we tend to become more and more reclusive. We want to be alone. We can't stand a lot of people and we say, what the heck, now I'm about 75, 80. Why should I have to pretend? So let me not talk to him. And then let me not talk to her. And then let them not come over. We'll end up becoming reclusive. We'll end up being alone. And man is a social animal. He needs to connect. So if he is not connecting enough, that's not a good thing. So however much we might think that I want to be alone, let's not allow that to happen. I'm not saying you have to stuff the day with people. I'm saying you certainly have to meet people and interact with them. We get into a situation where we have to look after our physical ailments. We get into a situation where we have to connect with people and we have to be as mobile as possible. The other thing is, a lot of people have found that, doing things with the other hand is nice. I actually tried this out. Most of us brush with, if you're right-handed, you take the brush in your right hand and you brush. Try brushing with your left. I tried it and the brush went up my nose. It's not as easy as it seems to be. If you normally would stand when you're in a particular way, try standing in another way. If you normally almost automatically shave with your right hand, try shaving with your left. These things seem to stimulate the non-dominant sphere and it seems to help. For the older person, especially if you know that there is a problem with memory already, please, please, please take all precautions and keep some identification with a phone number stitched in that person's shirt or pant. The number of people who have wandered out and who have been caught by Good Samaritans, fortunately, they still exist in our country. And the Good Samaritans don't know who to call because there's no identification. And of course, mom or dad who's wandered off doesn't know who he is, doesn't know where he stays. If you have some identification there, it's wonderful. So get that identification tagged into his shirt or pant, whether he or she likes it or not. Ensure that they eat a good diet. A Mediterranean diet seems to be very, very good, seems to be very effective. Mediterranean is more in fruits, nuts, salads, rather than too much of meats. We all should have whatever we like, but let's concentrate on this. Try to do things which maybe you haven't done before. A lot of people find it very useful to learn a new skill. And what we normally say is that if you're normally intellectual, so for example, I'm a doctor, I'm supposed to be intellectual. If I do something which is more physical, I do gardening or I learn carpentry, it seems to be very effective. It seems to stimulate parts of my body and my brain which are not been stimulated before. And it pushes to a later extent the dementia that may happen. If on the other hand, I'm more physical, then I try to do something intellectual which stimulates the other parts of the brain and seems to help. What are the other things that we look at? However difficult it might be, let us be aware of the fact that being a caregiver to a person who has dementia is also not easy. So I'm irritated with my son or my daughter for not looking after me, and I can't seem to prevent myself from being sarcastic, but I will make it a point to prevent myself from being sarcastic. It's very tiring for a caregiver to be constantly looking after mom and dad. And sometimes I see people who are dealing with their parents or aunties or uncles or even grandparents who have dementia or who are severely depressed, who are constantly talking of suicide. It's imperative for all of us to be in a position where we also give our caregivers some respite. A caregiver is not a robotic machine. He also has feelings. He also has conditions. I remember there was this lovely, lovely, lovely couple, and the woman came up to me and she cried and she cried and she cried. And she said that her son-in-law, her father-in-law, has been an invalid for 15 years. And initially she had no problems in looking after him, but now she just couldn't cope. And she was feeling guilty as hell, and she herself was a senior citizen. We have to deal with everybody. It is imperative for us also to be aware of the fact that if you have to take medication, you damn well take it. Let's not get frightened of medication. The myths associated with psychiatric medication are terrible. You're going to sleep all the time, you're going to eat all the time, you're going to become a zombie. I don't even know where they come from. And I really don't know where they come from. Very often I have a person on medication and he'll come and he'll say, लोग बोलते हैं कि ये क्या होगा. And I say, अच्छा, कौन लोग बोलते हैं? वो पता नहीं है, लेकिन लोग बोलते हैं. But who are these लोग? And I've never ever found who these लोग are. But these लोग are very important. The other very useful thing which should be thrown into the gutter is Dr. Google. Everybody looks at Dr. Google. Most of us take Crocin for a headache. You look at Crocin, you probably think you're going to die if you take Crocin. And of course, psychiatric medication means you're going to die, right? So please, let us be aware of the fact that we are in a situation where if you need medication, you need medication. If you need treatment, you need the treatment. And you're supposed to take it for as long as the doctor says you should. It's not that, if you're diabetic and you take medication and your sugar's under control, then suddenly it becomes, Doctor Saab, abhi main dawai band kar lu, kya mera sugar control mein hai? You wouldn't ask that. If you're hypertensive and you're having a major problem with your blood pressure, and then finally after 2 or 3 attempts, the cardiologist manages to get your sugar under control, you're not going to say, oh, doc, now my sugar's under control. My blood pressure's under control. Can I stop the medication? You're not going to do that. But somehow you come to me, you're severely depressed, you're almost suicidal. And I take pains and I give you medication and you're fine. And then you say, can I stop my medication? Bhai, ye nainsafi kyun hai? Let me decide when you should stop. Because if there is a relapse, the chances of your getting back take much longer and you're going to need much more medication and much more help. So just follow the doctor. Most of us are not bad people. Most of us know what we're doing. If there are side effects, we will deal with it. But sometimes taking one stupid tablet and living a good life, which makes a difference to yourself and makes a difference to everybody around you, should not be as bad as stopping that one stupid tablet and being a pain in one of the biggest muscles in our body. So what we need to do is to get into a situation where we are circumspect, we are sensible, we care, we are compassionate. And we don't believe that we are the psychiatrists and the neurologists and we know better than them as to when we should stop and when we should not stop. Because all said and done, Google is about 12 years old or 14 years old. And a lot of us have been in the field about 50 years. So I keep telling people, if you're so sure of Google, the next time when you have a fracture, put your hand in front of Dr. Google and say, wrap it up. It's not going to happen. Everything is not only theory, it's practical as well. So if you need medication, if it is suggested to you, if it is suggested that some therapy should happen, if it is suggested at times that you should get into an occupational therapy thing, which helps your fine motor muscles, that is again something that needs to be done. We need to do whatever we can to live the best life possible for the future. I'm leaving 6 minutes for question answers. I see a lot of very sweet and nice messages. Thank you all. There's lots more that we could talk about, but let's not disrupt our Ganesh Chaturthi celebrations by thinking of what can happen. Let's think of what we can do to prevent it from happening. Does Ayurveda help? I'm not absolutely certain. I'm not an Ayurvedic specialist. Certainly, it's known to help if you do massages and things like that. If there are aches and pains, it will help. I'm a little circumspect about a lot of the medication they give. It might cause problems. But like I say, I'm not an Ayurvedic specialist, so I would prefer to reserve my comments on that. A lot of people use things that everybody uses. Ashwagandha, Himalaya used to have Mentat, things like that. They don't do any harm. We don't know how much good they do, but I don't see any problems with that. But I get very freaked out when, for example, say you have an adult with epilepsy, fits, and he's on medication, and the medication is taken off, and some kind of Ayurvedic liquid is given or massages are given. That's not great. No, doc. I mean, no left trustee, madam. It's not specifically for you. It's for all of us, including me. Even I remember things which sometimes are problems. Yoga is known to help. Any kind of physical activity is known to help. Yoga is good. Now, one of the things I must talk about, I keep talking about obsessive tendencies, yes? Where you say you have a thought in your brain and it just doesn't go away. So you keep thinking and you keep thinking and you keep thinking. In such a situation, might be a good idea not to do meditation. Meditation is very useful for a lot of things. But if you're obsessive, it may not be a good idea to do meditation because the meditation might actually aggravate the obsessive thinking, which we don't want. But otherwise, meditation is also good. We have a lot of Indian practices which are good. I don't really think that they can take the place of medication if it is indicated. I mean, it's like if you have a fracture and I'm an orthopedic person and you come up to me and I say, go do yoga, that would be a little silly. But if I say get operated on and do yoga, that would be okay. So certainly use everything else that is available, but there is no substitute for getting a proper psychiatric neurological evaluation.
Yeah, any more questions anyone has?
Is it genetic? If both parents have had dementia and Parkinson's, what are the chances of us having it? Nobody really knows, but the chances are higher than. And this becomes a legal aspect, and it also becomes should I do it, should I not? So often I've been asked by people who come in and they say, both my parents had it. I'm scared I will get it. Is there any medication I can take to preempt it from happening? And I have to say, no, we can't give it to you to prevent it, but we can do all the stuff in terms of look after your blood pressure, look after your diabetes, take vitamins, take folic acid. Another thing that we also say is omega-3 fatty acids. They seem to help. So that is a supplement which everybody can take. I'm already taking it. I don't know how much it helps, but I take it. There's a lot of talk now which goes about nicotinamide, which is a vitamin B supplement, which is supposed to help. I don't know if it really does. It won't do any harm. But if people talk about other things which might cause problems, I'm a little nervous and negative about it. So for example, even for the older person, sometimes you give an antidepressant. We have to be a little careful about these things, which is why you have to go to a doctor who knows what he's doing. Others, you give an antidepressant, which is normally very good, but as a side effect of that antidepressant, especially in the adult older person, if it causes a constriction of certain things, muscles in the bladder, and he stops passing urine, you've got a calamity on your hands. So really, we have to be a little careful about who we are going to, what we are doing. If you forget a name, if you move from one room to another, what is the previous one? I missed it. Let me see if I can find it. That seemed very nice. Any particular brain exercises? You'll get a whole bunch of them in Google. That you can search. If you forget a name, if you move from one room to another, then remember it after delay. Is that NCI? Not necessarily. NCI. Okay, now I forgot to tell you actually that for all of these, we can also do psychological tests. So there's a whole bunch of tests that are done which check various parts of your brain and how they are functioning. And it has to come within a certain percentage. So say 20 out of 24 times you have to be right, 30 out of 32 times you have to be right. And if it's less than that, then we start thinking in terms of a possible problem. So things like that.
I've got a question, Dr. Kersi. I'm Dr. Sankhe speaking. Mitali's father.
Yes,
hello.
Sir. Hi. Yeah.
Hi. And I think it was wonderful to see you and giving us some tips.
Thank
because it's the most neglected subject nowadays that going to psychiatrist is some taboo in our society. So I think today, it will open up the eyes of our Lion members also. Because I have seen the doctors also, instead of going to psychiatrists, they go to psychologists and gurus and mentors.
Yes.
So something on that you can throw light, because it's very
Certainly.
important to get a good expert help.
Yeah. Okay. Just before that, Dr. Mala Seth has asked, can a patient have both Alzheimer's and Parkinson's? Yes, he can. Okay. But what Dr. Sankhe said, and thank you so much for that. I think a time has come when we have to accept that an illness is an illness. I think a time has come when, just like we talk about going to a cardiologist when you have a cardiac problem, or going to a gastroenterologist when you have a stomach issue. If you have problems related to something to do with the brain, provided you know it's to do with the brain, you need to go and see a psychiatrist. Maybe about 20, 30 years ago, it wasn't so easy. Today, I'm speaking on part. I mean, I myself, plus a lot of my colleagues, are actually begging patients not to come to us because we can't cope, which means that there are more and more people who have accepted that there may be a problem and they come and seek help. There is nothing wrong with it. It's not a sign of weakness. This whole thing of, I have patients telling me, "Main to majboot hu, main strong hu," and I say, what does that mean? Are you not strong if you have blood pressure? Are you not strong if you're asthmatic? Are you not strong if you get a heart attack? Then why are you not strong if you're panicking? Why are you not strong if you're depressed? Because it affects the brain. It's an illness. It's a problem. And if you have a problem, you've got to seek the help that you can. You've got to seek whatever help is available. You've got to do things about it, because if you don't do that, then you're an ass. You're not weak, you're an ass. So let's stop being an ass. Let's seek the help which is necessary. If you're talking about India becoming a superpower, we cannot become a superpower if we look at people who go for help in a condescending manner and say, ha, ha, ha. That's ridiculous. If you have a problem, seek the help for it. Take the treatment for it. And 99, if not 100%, will do better. Be more controlled. Make life easier for the rest of them in the family. Somebody has asked a very nice question. I was reading it. Can you advise silence meditation for anxiety patient? I'm not certain. I don't know what you mean by silence meditation. I think you mean meditation, which is done in silence. It all depends on the individual person. So it's not just anxiety. It's a whole bunch of things that we look at. Meditation could certainly be used for it. Does it help living in a joint family? To some extent, yes, and to some extent, no. If the joint family is supportive, it's wonderful. It's also much less stress on one individual caregiver. And the person who's got the problem very often doesn't like to stay alone. So if he doesn't like to stay alone and he's in a joint family, there's always somebody there, which makes his anxiety much less. Plus, the caregiver gets respite. So it's often useful in a joint family. On the other hand, if it's a horrible joint family, and sometimes we have them, then you're better off not being in a joint family. I love this one by Balkrishna Iyer. It's our duty to take care of our senior lions who are around us to help them out. And I have seen many times not keeping of advice, but fate is beyond our control. Yes, I think we have to become a more compassionate society. I mean, if the whole world could come on the streets and fight for our dogs, then we certainly can fight for the older person who's having psychiatric issues. We certainly can help out people who are alone and frightened, because let's face it, we're also going to get old and we're also going to get frightened. More often than not, the onus of mental health is only on the mental health professional, but it's time that the community comes together and shows empathy towards each other. That's an absolutely lovely sentiment, Mr. Sai Guru Prasad. So thank you. That's lovely. Mitali, complete silence Vipassana for 1 week. Does it help, or it's case to case for mind related? I think it's case to case, Mitali. One can't generalize. I think I've gone through all. A very active maid has been diagnosed with CJD. Okay, I'm very sorry to hear that. This is Creutzfeldt-Jakob disease, not very common, but it's seen. Prognosis not very good. She's going to need a lot of help. I hope that it's not going to be too bad.
So I would like to request our Governor sir for closing remarks. And before that, I would really, like to thank from everyone, Dr. Kelsey, In spite of your busy schedule, you gave us this time, and it was really, really an eye opener, because we all have somebody at home, or we will be heading towards that. So it's very difficult, otherwise to manage them, because at times, yeah, as a caregiver, we lose our temper. And though I'm into this profession where we run this mental health helpline, which is completely free of cost. So I would also like to show, Shri, if you can show this helpline number, because it's completely free. It's toll free also. And we have counselors, psychologists, psychiatrists, everyone, like it's a team of people who are dedicated to this particular purpose. So this is completely free of cost. Anybody who wants to seek help, they can always connect with us, or otherwise Dr. Kairsey is anyways there.
Sure, you're more than welcome.
Yeah. Yeah. So over to you, Manojji. Yeah, Shri, you can stop that. Yeah.
Sir, you're
mute.
You're not. You're muted.
You're
Sir.
on mute.
Well, first of all, I would like to thank Aarti ji for organizing this Zoom meeting with Dr. Kairsey Chawda ji, who has enlightened us about the many things about the mental health, and we need to be very, very careful. I said to Dr. Chawda ji that our very active mate since last 50 years was diagnosed with CJD. We were thinking about dementia and Alzheimer's disease, but it came out to be CJD. Now she has been hospitalized. We are praying that she recovers from it. And it is really, really very enlightening for all of us. And mental health is a subject which needs to be taken care by each and every one of us. Thank you once again, sir, for being the part of Lions Club today. Thank you very much.
It's been a pleasure. Look after all your friends.
Thank you, sir. Thank you. Thank you.
Thank you so much, and good night to everyone.
God bless.
Thank you. Bye, everyone. Thank
Bye.
you.
Bye.